Good afternoon, everyone. For today's Hear from Peer sessions, we will have Dr. Diane Chico. Uh, she is an instructional professor and head of the Department of Medical Education in the College of Medicine. She is an experienced anatomy educator with over 25 years of teaching gross anatomy, histology, and neuroanatomy in the pre-clerkship undergraduate medical curriculum. An advocate for inclusive student-centered teaching, she is invested in creating and promoting a dynamic learning environment that supports students' educational success and professional development. I will give the floor to you, Diane. Please feel free to start your presentation.
All right, thank you, Armando. Let me share my screen. And so can we see the image?
Yes.
Okay, right. Good afternoon, everyone, and thank you for your time today. I'm hoping that this will be a time for us to share what I've done and especially to learn from you on regarding the challenges I have experienced. So for today's presentation, I wanted to talk about some of the challenges of piloting generative AI in a medical histology lab where I am one of the faculty members. And so for our session objective, the aim is to summarize student perception of using generative AI as a study aid, which includes survey results on the perceptions and then pilot reflections for the students who completed the activity. I also wanted to mention some of the challenges of incorporating a generative AI activity as a study aid in in a medical histology lab. So why do this? The purpose of this activity was threefold. First off, to introduce our students to the use of generative AI as a study aid. With more and more information out there of using generative AI in medical education, we want our medical students to be prepared for how they can use AI. And one of the areas they can use it is as a study aid. And so for this particular activity, I did two pilots. One was really the preliminary pilot, which occurred during a 3-week summer pre-matriculation program, which we call MedCamp, and then tried to see how our full class would view this activity in our semester 1, which is occurring right now in a first-year medical curriculum. And the second part is I wanted our students to also think about what are some of the pros and cons of using generative AI under this situation, and also engage them in an active learning approach and one of many to learn the content during the first semester. Now, the first part of the activity was to ask the students what's their thoughts in using generative AI as a study aid. And so this is completed through Microsoft Forms. And there are 3 main questions that I asked that are listed here. First off, whether or not they use generative AI in their day-to-day studies and their comfort in the outputs that they received by generative AI tools, and whether or not they believe generative AI can eventually enhance their learning experience. So what were their thoughts? When I looked at it, the very first one is to what extent do they use generative AI in their day-to-day studies? So this is information both from our MedCamp students, of which we had about 25, 26, and our Fall 1 students, of which we had about 170 this year. So we had pretty good response rates of roughly 80% responding. So one of the things I wanted to focus is, even though most students do not use it almost equal in both MedCamp and during our M1 matriculants, there were still a small number who actually did use or are familiar with using generative AI. And in asking whether or not they were comfortable with the outputs generated by generative AI, when we look at this, there were really the majority very similar or close to it who were not confident at all. But there are some who had some confidence, and then there were always a small percentage who were very confident with the use of AI. This may look like it's mixed reviews. However, it does show that students, while they are familiar with AI in general, they don't really use it as much for their education or their studies. The third and the last question was, do they believe that generative AI can effectively enhance their learning experience? And so while the prior data show that there are a number that were not confident, those overall, when they think about generative AI and its potential uses, they do still agree overall that it may help them to effectively enhance their learning experience. Now, what was it exactly that the activity I asked them to do? So this one essentially describes the activity. It was a two-part activity. The first one really is in working and how to use prompt engineering. And then the second one is it's the activity where they use it to integrate concepts from one of their handouts. So just make a note that in this particular one, there were points, total points associated with it. This we only used for our pre-matriculation course or MedCamp. The assignments for the semester one course that the students just completed actually last week, they were not graded because the intent was them just to explore the use of AI rather than having it graded for that purpose. So for the first week, even though this is related to the weeks for MedCamp, we had the students do this throughout all 12 weeks of Form 1. So essentially what we wanted to do, we wanted them to select at least one session handout. In this case, for MedCamp, I focused on histology. For the semester one I teach in, they could choose it from histology or from physiology. Specifically because a lot of these handouts are from our faculty and they do still have some concerns on whether or not to post their handouts. We did ask the students to use the Texas A&M University institutional version where it's really kept more in-house. And this is the prompt that I wanted them to use. The first one was actually create a one-page summary of an attached PDF handout. And then they'll receive the output, followed by refining the summary to include clinical relevance, since this is a medical course. And then I wanted them to review their generative AI generated information and then compare to session notes and the readings. And part of this is also to provide them the opportunity to do their second or third pass of content after attending a lecture. And additionally, the next prompt, which is something that related to the creation of a quiz for our MedCamp session, was to create 2 National Board Medical Examiner or NBME style questions with 5 answer choices and 1 correct best answer based on concepts from the attached file, and copy and paste it on a Word file. So just to put a side note, the NBME style questions are the board exam questions that our students prepare for, not only for the NBME, but also for our step 1 board exams. And so we're also getting the students used to the format of the questions they will be receiving on their boards. And then next thing is, after they've received the 2 questions, the prompt was for them to then add a clinical vignette to the questions. Because more often what we're doing is asking the AI tool or ChatGPT to just write a question based on the handout. And then we want them to now write it in a clinical vignette, which is what they would often see in a board exam question. And then this is where, again, the independent learning comes into play. Is where the students will look at the questions that were created, look at the answers, and to confirm the correctness of the response provided to them by the AI tool and the explanation of that response. And then on their own words, they are then to provide brief explanations for each of the incorrect answers from the follow-up from this prompt 2B. And they were to submit it to the Teams classroom. And additionally, I will review their AI generated questions and use it to create a quiz that they would be completing after the last histology lab. So this was one of the activities that they did. So this was an example of the prompt, the type of questions that they would be receiving when I explained it to them. So the prompt one was based on a connective tissue handout or file that I uploaded, and I told them you will read that most of the information they give you is more for recall, straight identification questions. So this is the response from the prompt one. Therefore, I had them do a follow-up prompt to add a clinical vignette into the NBME style question. And so this is the type of vignette that they would receive. And then they would then look at the questions, their answer choices, and to make sure that they are the correct answer choices, the correct choices to be included with the question, and to be able to make sure there's only one best answer to the question prompt. So following that, another survey I wanted to have the students complete is a reflection, because it's more than just practicing the activity. I wanted to see what they thought about the use of generative AI. So these are the questions in Microsoft Form. They were all free answers except for one. I wanted them to comment, if they so wish, how clear were the responses that they received from the generative AI tool. What value did they perceive in using AI to create the summary of the handouts and generate practice questions? That is, how useful is generative AI as a study tool? And then I wanted them to give an idea of their level of confidence in learning the handout concepts, especially after using generative AI. So I did it based on a numerical a Likert scale. One, for the tool not affecting their confidence, two, for low confidence, three, for confident, or four, very confident. And then there's a brief comment, an optional comment if they so wish to add. So what were the outcomes? With the student reflections, again, these are the questions that were asked on the student reflections on the Microsoft form. And these were the responses. So for MedCamp, most of the reflections actually came from our MedCamp students, who then eventually started the semester one in late July. So we had 19 students respond. And these are clouds generated by the response clouds or word clouds generated by Microsoft Word. And so for the clarity of the responses they received to the prompts, many of them did state in reading through the comments that they were fairly clear and straightforward. However, throughout a few of the responses, they consistently noted errors in the response, or they were giving too much details or too much information on the response that really didn't pertain to them at that time. Usefulness for the AI as a study tool. Most of them felt that it was useful to provide practice questions. There were also at least one who stated that it gave them an idea of where to start and also provide a vocabulary or a vocabulary bank to use. However, they did stress again that there were oftentimes extraneous information, or for some, there were rudimentary questions that were not at the level that we would ask them during an examination. For the following two, when it comes to the level of confidence in learning concepts, the concepts from the handouts after using AI, it was an average of 2.42 rating, to where it was, for the most part, they had low confidence to some confidence, depending on who the response rate. So they do have some confidence, but they still have some concerns. And when it comes to the comments, there were only a few who provided comments, about 6 or 7 who provided comments on their confidence in using AI. Overall, the majority of them stated that it helped provide a baseline understanding of the topic that they were studying. And they did provide summaries that oftentimes, when they have so many pages in a handout, having it summarized for them in language that is more to their level helped them. And yet, at the same time, several of them noted that they oftentimes had to go back and double check to make sure the information they gave them was correct. And also to, if there are questions, to make sure that what they're reading really is an appropriate scenario related to what their topic is. And this is something that we wanted the students to learn, because when we're using AI for information, we can't just rely on AI, even though they are looking at so much vast information. This one is for them to really be critical in the information that they receive. So when it comes to what are the challenges, first and foremost, what came to mind and what students reported to me anecdotally is that this is the transition to medical school, and the pacing is very quickly, because in semester one, they are taking 3 major courses, two of them, two lab-intensive basic science courses, of which I teach in, and a practice of medicine course. Additionally, they have multiple resources. They're using Anki cards, they're using question banks, and they also had 2 pilot activities in addition to this that were intended to help them better learn the content in the histology and physiology disciplines. And what we noticed also, which I did let the students know, that there is a size limit to what we could upload on the institutional co-pilot available to us. And so students sometimes had to do page by page, because some of our handouts also were image intensive. And there was a time commitment, considering that there are 12 weeks of the first course, they're literally going at full speed. Sometimes they didn't have the time to really fully look at the information to ensure that the responses provided to them were correct. So what were the opportunities for improvement that I saw? First and foremost, one of the things that I've already started thinking is, when I give the explanation again to creating prompts, I wanted to provide a guide on scaffolding the prompts using a Bloom's taxonomy model, so that they, for our course, really as one of the foundational courses, one of the main things is to start at the remember. So create some questions to help them define and identify structures, identify terminology, and then move on to a prompt that asks their understanding. Can they classify, can they discuss or explain the concepts that they're being taught in histology and physiology? And then the application stage. How can they then demonstrate the knowledge they have in the foundational sciences with the clinical scenarios, with some of the basic clinical concepts that they will be encountering when they are physicians and meeting with their patients. And rather than it just being an assignment that is that they do outside of class, what I'm thinking is incorporating it as an activity in class, taking a portion or having them do it during the laboratory component, so that they have faculty there who will be able to help them when they're needed. And speaking of faculty development, I feel, is going to be something that's very important, because while many of our faculty use it more on the research side, it's oftentimes really the prompt. How can we help our students write the prompt for them to create a very good question bank, as well as using this effectively as a study tool? So that's the project that I started this summer, and there were some of the challenges and opportunities for improvement. And I'm happy to answer any questions.
All right. Yeah.
Mhm.
Thank you so much, Dr. Chico, for presenting. I will stop recording.